Welcome everyone. In this chapter, we are going to study vitamins. Vitamins are essential nutrients needed in small amount for normal growth and health, good health. Let us learn them step by step. In this chapter, we will learn the definition and the classification of vitamins. Then we will study the source, chemical nature, function, coenzyme form, recommended dietary requirement, and definition disease. We will cover back fat soluble and water soluble vitamin. The word vitamin comes from the word vitamin, the meaning vital again, because vitamins are essential for life. Vitamins are organic compounds present in the natural food and they are required in very small amount, so they are all called micronutrients. Vitamins do not give energy directly, but they help to body called micronutrient. Vitamins do not give energy directly, but they help the body use carbohydrate, protein, and fat properly. Some vitamins like vitamin K and some B vitamins can also be produced by gut bacteria, but still will depend mainly on diet. Vitamins are organic amount in food needed in very small amount for growth and maintenance good health. Most vitamins cannot be synthesized sufficiently by body, so they must be supplied through the diet. Water soluble vitamins are not stored much and excess in is stored in urine. Fat soluble vitamins can be stored in liver and adipose tissue. So deficiencies appear slowly, but excess can cause toxicity. Vitamins help the body resist disease and improve immunity. They prevent and cure disease caused by vitamin deficiency. They also support digestion and proper use of minerals and carbohydrates. Vitamins support nervous system strength and help maintain normal growth and overall health. Now we see the classification of vitamins. Vitamins are classified into fat soluble and water soluble vitamins. Fat soluble vitamins are A, D, E, K. Water soluble vitamins include the B complex group, such as B1, B2, B3, B5, B6, B7, B9, B12, and more non-B complex vitamins. C. There are also vitamins like compound such as choline, industrial lubric acid, and phosphorus. Let us compare fat soluble and water soluble vitamins. Fat soluble vitamins dissolve in alcohol and organic solvent, and they are absorbed along with fats using pilots and chylomicron. They need carrier protein for transport and they are stored in liver and fatty acid. But water soluble vitamins dissolved in water do not need fat absorption mechanism. Usually do not need carrier protein and they are not so much expected vitamin B12. Fat soluble vitamins are not accumulated easily in urine, so they can accumulate in the body. Most fatty acids soluble vitamins do not act as coenzyme except vitamin K. Their deficiency is seen only when body stored and depleted, and treatment can be given as single large dose. Water soluble vitamins are created in urine when it gets taken, so toxicity is rare. They commonly act as coenzyme and deficiency should develop quickly. So regular daily dietary supply is needed. Some deficiencies like B1, B6 and B12 can show neurologic health system. Fat-soluble vitamin can cause hypervitaminosis, meaning toxicity due to excess accumulation, especially vitamin A and D. Water-soluble vitamins generally do not cause toxicity because excess too exaggerated. This slide also highlights sulfur-containing vitamins such as thiamine, pantothenic acid, and biotin and lipoic acid. Now we see the coenzyme form of major vitamins. Thiamine acts as TPP in oxidative dehydrogenation and trans-glucolysis reaction. Riboflavin from FMN and F88 which help oxidation reduction reaction. Niacin from NAT and NADP also for oxidation reduction reaction. Pantothenic acid from coenzyme A alkyl transfer reaction production from APLP for amino acid metabolism like transamination and decarboxylation. Biotin from biochitin for carboxylation reaction. Folic acid from THF for one react carbon transfer. Vitamin B12 from methylcobalamin and adenosine for methyl transfer and isomerization reaction. Vitamin A dietary sources include animal and plant sources. Animal sources provide active retinol such as milk, butter, cheese, egg yolk, and fish liver oil. Plant sources provide beta-carotene such as carrot, papaya, mango, pumpkin, and green leaf vegetables. In the body, beta-carotene can be converted into vitamin A. Vitamin A is insoluble in water but soluble in fat and organic solvent. It is act an antioxidant and insensitive to light and heat. Vitamin A acids mainly as retinol, and retinoic acid form and age form has a specific role in the body. Vitamin A is insoluble in water but soluble in fat and organic solvent. It acts an antioxidant and insensitive to light and heat. Vitamin A acids mainly as retinol and retinoic acid form and its form has a specific role in the body. Now we learn daily requirement of vitamin A. The requirement is as RAE, which means retinal activity equivalent. Men generally need around 750 to 1000 microgram per day. Women around 750 micro per day, and during pregnancy increase. Children require lower amount depending on age. This is important because too little causes deficiency and too much can cause toxicity. Now we learn the function of vitamin A. Vitamin A supports immunity and help prevent against infection. It is essential for food vision, especially night vision. It helps maintain healthy skin and learning of organ. The active form retinol is formed from retinol and used in vision. Hyaluronic acid active like a hormones and help in the cell growth and differentiation. Vitamin A deficiency mainly affects the eye and skin. It can cause xerothalmia which can lead to childhood blindness. Severe deficiency can cause sclerodermalgia where the eyeball and may be damaged. Skin changes like sclerodermia and follicular hyperkeratosis can also occur. Now we study vitamin D, also called calcifer. Vitamin D is now as anti-erythritic vitamin because it prevent and correct it to a wide citrulline substance, fairly heat resistant and soluble in fat and fat soluble and vitamin D is very important for calcium and phosphate balance. Vitamin D sources include sunlight exposure and light. Sunlight helps the body produce cholecalciferol in the skin. Food sources include fatty fish like tuna and salmon, fish liver oil, egg flour, and beef liver. Some food like dairy products and flour may be fortified with vitamin D. Short sunlight exposure a few times a week also help maintain vitamin D levels. Vitamin D is insoluble in water and moderately soluble in fat and ethanol. It is sensitive to oxygen and light, and heating for mild acidity can convert it into inactive form. So proper storage and adequate exposure are important. Now we learn that dietary requirement of vitamin D. Adult required around 5 microgram per day. Children around 10 microgram per day, and older adult need higher amount. Pregnant and lactation also need more vitamin D to support bone health of mother and baby. Vitamin D helps regulatory mood, cell growth and differentiation. It is essential for healthy bones and teeth because it supports calcium absorption. The active form is calcitriol, which act like hormones and support calcium and phosphate balance. Deficiency causes education, children and Malika and it may also contribute to osteoporosis and other disorders. This slide explains the deficiency consequence of vitamin D in a clinical way. Intricate bones adulation is impaired due to low calcium, phosphate, or vitamin D. Serum calcium may be maintained due to parathyroid hormones, but bone alkaline phosphate become high and the calcium phosphate products become low. In adult vitamin D deficiency cases osteomalacia, where bone become soft and weak. Now we see clinical cases of the case. Children have delayed closure of frontal ears with fruitary and soft curl called carginotabis. They may develop leg just change include station jacks and aesthetic grocery. Teeth may show dental hypoplasia and growth may be stunted. Now we see Astromelica clinical method. Arthromalcia means soft bones due more mineralization of the thickened bone. Patient may get back pain with bone fracture easily and is trapped first blood content through low phosphate high alkaline phosphatase and reduced calcium phosphate produce. Vitamin D deficiency usually does not cause a severe hyperglycemia, so tension is not typical. Vitamin D deficiency can occur to less sunlight exposure and poor dietary intake. Malabsorption conditions like successful jaundice and tetrodotoxy can reduce absorption. High fat diet reduces calcium absorption. Liver and kidney disease can block activation of vitamin D. Long-term anticoagulant therapy can also increase deficiency risk. Now we study vitamin D, also called tocopherol vitamin E is fat-soluble vitamin and now as anti-fertility and anti-sterility vitamin. It is a strong natural antioxidant that protects cell membrane from oxidative damage. Vitamin E is light yellow oil and can be dissolved by ultraviolet rays. Vitamin E sources include vegetable oil such as white grain oil, sunflower oil, safflower cottonseed oil, olive oil, and coconut oil. Animal sources include eggs, meat, butter, and milk, but milk is poor sources. Remember that fish liver oil are not good sources of vitamin E. Vitamin E is insoluble in water and soluble in fat and oil. It is stable in air and acts as an antioxidant. Vitamin E remains as an oil at temperature and protects with body tissue from free radical damage. Vitamin E requirement for adults is about 50 milligram per day. Vitamin E helps maintain healthy retina cells and support proper visual function. It also supports immunity and protects the body as an antioxidant. It helps in cell growth and differentiation. It is active form include tocopherol and tocopherol. Vitamin A deficiency in human but can occur due to impaired absorption, such as cystic fibrosis, short bowel syndrome, bile duct absorption, or fetal propertonemia. Deficiency can hemolytic leukemia, nerve absorption problem like peripheral neuropathy, muscle weakness, and more nerve condition. Vitamin E is concentrated to release toxic fatty acids vitamin but still balancing is important. Now we study vitamin K, also called phenolphthalein. Vitamin K is known as anti-hemorrhagic vitamin because it supports blood clotting. It is fat-soluble vitamins and act as coenzyme in activation of clotting protein like factors. Second, fourth, ninth, and 10th vitamin K is sensitive to light and is important for normal coagulation. Vitamin K includes vitamin K1 called phenolphthalein and vitamin K2 called minoquinone. A good indicator of vitamin K status is measured in phenolphthalein in blood. Vitamin K2 is often produced by bacteria and is found in some fermented food. Vitamin K is insoluble in water and soluble in fat and organic solvent like ether and chloroform. It is sensitive to light, so it could be stored properly. Vitamin K requirement for adult is around 120 microgram per day. Vitamin K support blood clotting and also help maintain healthy bones. Vitamin K is as K1, K2 and K3 form. Deficiency reduces blood clotting power and can cause bleeding, especially in infants where hemorrhage may occur. Now we begin water-soluble vitamins with vitamin B1 thiamine. Thiamine is important for carbohydrate and metabolism and is called antiperipheral. Plant sources include whole grain, legume, and refined and whole white flour. Animal sources include liver, kidney, milk, and is a key point is polyethylene rice removing most of the thiamine. This is why thiamine deficiency is common where polyethylene rice is stable food. Thiamine is highly soluble in water, moderately soluble in methanol and glycerol, and insoluble in fat and oils. It is colorless crystal since it is water soluble regular intake in nature. Thiamine requirement for adult is about 1 to 1.5 milligram per day and higher during pregnancy and lactation. Thiamine helps convert carbohydrate into energy and support muscle contraction and nerve conduction. It is coenzyme for thiamine pyrophosphate. Deficiency causes beriberi, loss of appetite, and peripheral neuropathy. Now we study vitamin B2 riboflavin. Riboflavin sources include dried fish, liver, kidney, heart, egg, milk, and fish. Plant sources include wool, carrots, legumes, green leaf vegetables, and germinating grams. Riboflavin can also be synthesized by intestinal bacteria. Riboflavin is essential for growth, development, and cellular function. It is moderately soluble in water, insoluble in fat and oil, and it is light sensitive. That is why come milk container and designed to reduce light exposure. Riboflavin requirement for adult is about 1.2 to 1.7 milligram per day. Riboflavin work as coenzyme FMN and FAT. We take part in oxidation reduction reaction. It support blood cell production and body growth. Riboflavin deficiency is called herbiflavinosis. Cases include malnutrition, chronic alcoholism, malabsorption, anorexia, and some treatment like prolonged phototherapy. Symptoms include cholestatic cellulosis, angular stomatitis, dermatitis, and coronal vascularization. There is mouth, corner, fusel, and classical skin. Now we study vitamin B3 niacin, also called nucleotide acid. Rice sources include dried yeast, liver, peanut, and whole crackers, legume, meat, and fish. About half of the niacin requirement can be met by converting tryptophan into the niacin. Niacin is important energy production and normal cellular processes. Niacin is amphoteric in nature, soluble in water and insoluble in fat, and stable in dried form. Daily requirement is about 50 to 20 milligrams. Niacin form coenzyme NAT and NATP, which are central in energy metabolism and redox reaction. Therapeutic niacin can also affect glucose and uric acid level, so it used carefully. Niacin deficiency causes pellagra, classically described as the 4 Ds: terminally diarrhea, dementia, and death when untreated. Mild deficiency can cause irritability, poor concentration, anxiety, fatigue, and depression. Severe deficiency so as skin, gastrointestinal inflammation, mental confusion, and neurological problem. Pathology-Lec is a classical in kidney. Now we study vitamin B5 pantothenic acid. It is widely distributed in nature and called a sick and terminated factor. Good sources include liver, egg, kidney, yeast, milk, and whole grain. It is also in the shit by intestinal bacteria. Pantothenic acid support energy production and metabolism of fat, protein, and carbohydrate. Pantothenic acid is yellow viscous oil. It is soluble in water and weather and insoluble in fat. Its main function is through coenzyme A, which is needed for many metabolic pathways. Many enzymes depend on coenzyme A. Deficiency causes burnout syndrome with pain, numbness, fatigue, and sleeplessness. Now we study vitamin B6, which include pyridoxine, pyridoxal, and pyridoxamine. Vitamin B6 support protein metabolism and production of red blood cells, neurotransmitter, and hemoglobin. Sources include white grain, garlic, green leaf vegetables, legumes, algal seed, egg meal, meat, fish, and yeast. It can also be synthesized by intestinal bacteria. Vitamin B6 is highly soluble in water and insoluble in chloroform and fat. It is colorless, crystal, and soluble in solution. Daily recommended is about 2 to 2.2 mg per day and higher during the pregnancy and lactation. Now we study the vitamin B7 biotin, also called vitamin H. Biotin is a sulfur-content vitamin and helps metabolism of lipid, protein, and carbohydrate. Sources include legumes, and grain, tomato, carrot, each bean, cauliflower, and animal sources like liver, kidney, egg, frog, salmon, and milk. Biotin can also be produced by intestinal flora. Biotin is a white crystalline substance. It is soluble in water and insoluble in fat. Daily requirement in the slide is given as 100 to 300 mg because it is water insoluble. Regular intake is important. Biotin support synthesis of fatty acids, citric acid cycle function, and gluconeogenesis. It is sometimes used to support healthy hair, skin, and nails. Its coenzyme form is biochitin. Deficiency syndrome include anemia, loss of muscle, dermatitis, and psychological effects like depression and now we study the vitamin B9 folic acid. Plant sources include the plant broccoli, avocado, citrus fruit and beans. Animal sources include egg and beef liver, footwear food like flour. Breakfast, carrots and bread are also important sources. Flourled in fortified food and supplement has higher bioavailability than the naturally occurring fold in food. Now we study vitamin B9 folic acid. Plant sources include beans, broccoli, avocado, citrus fruit, and beans. Animal sources include egg and beef liver, breakfast carrots and bread also important sources flowed in the fortified food and supplement has higher bioavailability than naturally occurring floral in food. Folic acid is stability in light. It is soluble in water and insoluble in fat, and it is a yellow crystalline substance. Daily requirement is about 200 microgram or adult. Higher in pregnancy and lactation because for rapid cell growth. Folic acid is help in the production of DNA and RNA. So it is very important in fat growing stage like infancy, adolescence and pregnancy. It is also support iron metabolism and help maintain iron levels. The coenzyme form tetrahydrofolate deficiency causes macrocytic and megaloblastomia and can cause natural tube defects in fetus. Now we study vitamin B12 cobalamin. Vitamin B12 cobalamin is unequivocal. It is synthesized only microorganisms, not by plant and animals. So plant food do not naturally contain vitamin B12 unless fortified. Animal sources include liver, egg, milk, chicken, and bark. Vitamin B12 supports genetic material information, red cell production, and nervous system maintenance. Vitamin B12 is not red to yellow crystalline substance. It is soluble in water and insoluble in fat and stable to heat. Daily requirement for adult is around 3 microgram and higher during pregnancy and lactation. Vitamin B12 supports red blood cell production and DNA synthesis. It is essential for proper brain and nervous function. Coenzyme form include methylcobalamin and adenosine deficiency causes microplastotomia and neurological disorder, infertility issues, and demethylation, which affects nerve condition. The slide show B12 deficiency manifestation like demyelination and subtracted component degeneration. It is also connected B12 deficiency to like the floral trap and hyperhomocysteemia, which can increase cardiovascular risk. So, vitamin B12 deficiency affects blood, nerve, and long-term health. Now we study vitamin C, also called aspartic acid. Vitamin C is water soluble and found in higher amount in citrus fruit, gooseberry, guava, green vegetable, and tomatoes. Vitamin C is called and carpeptic vitamin because it is prevent scurvy. The acidic property of the vitamin C is due to phenolic hydrolysis group. Vitamin C support immunity and tissue health. Vitamin C is soluble in water and insoluble in fat. In aqueous solution, dehydroasparbic acid is unstable. Daily recommend for adult is about 60 to 70 mg and it is water soluble daily intake in important. Vitamin C help maintain healthy skin, blood vessel, bone and cartilage. It is support wound healing and help the body fight infection. It supports healthy hair growth. The active from asparagus acid deficiency catches scurvy with core gum, lactate, anemia, reduced immunity and delayed food killing. Now we can be in more detail. Vitamin C deficiency causes abnormal collagen formation, which make intercellular substance weak, capillary fragile, and bleeding easy. It is lead to peritechnic aqueous bleeding, swallowing painful and internal bleeding like nose bleeding, blood in urine or blood in stool. Also, core biochemical reaction behind herpes is refers to collagen information.